So the topic that I'm going to talk about today is child sexual abuse in the primary care setting. It's a pleasure for me to not the subject itself, but really talk about a topic where my two interests intersect, and that's child abuse and primary care. A lot of us might think that you really don't see it much, but my hope is to change your mind today after today's presentation, that it's actually there, present, and visible if you're looking for it, and sometimes when you're not looking for it. Okay? So I have some learning objectives for you today. So when you walk out of here, these are the things that I'm confident that you'll be able to do as a result of this talk. You're going to be able to give a definition and describe the different forms of child sexual abuse. You're also going to become familiar with some of the dynamics. A lot of times, just like all pathological states, if you are unaware of some of the preconditions to a state, sometimes it's very hard for you to diagnose it early. So we're going to think about child sexual abuse as a pathological state, and we're going to talk about some of the dynamics around that. We're also going to detail the primary care pediatrician's role in screening, identifying, and documenting, as well as reporting child sexual abuse. A lot of times I feel like the presentations you guys get are very much filled with the reporting part. And that's actually one of the things, though our presentations are top heavy with the reporting, we still don't do a really great job. So I'm going to try to cover all of that, okay? So let's start out with some clarifications. In terms of a definition, the AAP Committee on Child Abuse and Neglect defines sexual abuse, which I'm going to refer to in the course of this talk as CSA, as the engaging of a child in sexual activities that the child cannot comprehend, for which the child is developmentally unprepared, and cannot give informed consent, and or that violate the social and legal taboos of society.